there are bigger companies that will say, plaster it with pink and say, we're going to give 10% of the proceeds to what? Like, sometimes they don't even say. Like, who is the money going to?
To breast cancer research.
Right. What does that mean, right? Who is it going to and how much? You're a multi-million-dollar company. 10%, I'm sorry, is not good enough.
I'm Erica.
And I'm CJ.
And you're listening to the Her Podcast.
Today's episode, we're sitting down with Dr. Amy Morris, and it's going to be an eye-opening conversation filled with super practical information on the world of women's health, specifically around cancer prevention, common types of cancer in women, and the signs to watch out for. Dr. Amy is a cancer survivor herself and has a doctorate in cancer care, so she knows her stuff. On today's episode, we talk about the two types of cancers that affect women the most, genetic risk factors, strategies to lower cancer risk, and we're also debunking myths about foods linked to cancer. You're not going to want to miss this episode with Dr. Amy, and you're probably even going to want to take some notes. So have a notepad or your notes app ready, get cozy, and turn it up. This is a good one.
Like, lots of people wait until after Christmas, right? We actually see like the people being diagnosed less frequently in December. And it's not because people don't get cancer in December. It's because they are like, I'll just wait till after Christmas, or I'll wait until after the New Year, and then, oh, okay.
And so then do you see people coming in, like, other than January, are there other times where you see more of an influx of people being aware?
September, for sure. Like, they'll wait until after the summer, right? Like, my kids are out of school, I'm on summer vacation. Let me just wait until then we get the kids back into the dentist and the optometrist in September. And then I'll go get my checkup, and the rates go up then too.
Wow.
Interesting.
Yeah.
Do you feel like people then postpone a little bit, like their appointments around, especially women, right? Like around our life and our schedules, and probably like kids and things. And we prioritize ourselves last, and we're like, oh, I think I should do this, or I've been noticing this thing, but like life is so hectic right now. So like I'll get in after X or
so many.
Okay.
Yeah. So many times people do that, and it's almost like second nature for women, right? Yeah. It's because I'll just wait until all of this settles down and then get back to it. And it just is so awful because like in your head, you're like taking care of everyone else.
Yeah.
But I'm a mother myself, and I always say to my family, like, y'all are screwed if something happens to me.
Preach.
Like, you are all ruined. Yeah. So I've got, like, today, I've got to go get a massage. I was like, because I can't carry you guys if my neck's ruined. So I've got to do that in order to take care of you, right?
Yeah.
So you're seeing a delay in diagnosis in women.
Yeah.
And this is a cause of it, is
Totally.
that we're just putting ourselves last.
Totally.
In getting into the doctor.
That's part of it. The other part is that a lot of the detection of cancer in women is really like archaic almost.
Okay, let's go into that. I want to hear that.
So like when we talk about breast cancer, is the most common type of cancer. We talk about mammograms. Like mammograms in and of themselves are archaic.
Like, I've never even had one.
You like squish your boob.
I've had one, and it was awful.
Was it uncomfortable?
Machine squishes it.
Legitimately. And you're like, can you're like, okay, I can handle a little discomfort, but you're like, what if it goes too far? You're like, I don't got like that. I don't have that much to work with. I'm like, we're about to get deflated here.
Exactly.
Come home flat.
Okay. So just like that.
Why is it archaic?
Because you shouldn't be in discomfort to have a screening procedure.
Okay.
Like, let's flip that to the male side. Like, do we ever squish something there to see if there's
Squishing their balls or something?
Can you imagine? There would be an uproar.
There would never. But they're like,
be an
women,
uproar.
just put your boob in this machine. I mean, I've never had one, so I don't know what it actually is.
We're starting to see like more improvement there, like breast MRIs, like where you just stick your breast into an MRI machine, but it's like just holds it within the machine. It doesn't like flatten
This
it.
is like like I've had MRIs, so I'm like trying to picture this. I'm like,
is it a special
like
machine?
A table.
Do you like walk up to it?
You lay on it.
Oh, okay.
Yeah.
So would they only be doing the MRI if they already feel okay? So like, because I've never even. I mean, every once in a while I'll be like,
Yeah,
Let's
sure.
going
think they're
on
okay.
here?
Like, what's going on? And I've had a couple friends with breast cancer who are like, you'd notice, like you would like feel something. But let's quickly talk about maybe the first step with a diagnosis is really at home.
Yeah.
And not, I'm not saying we diagnose ourselves. I'm saying like checking our own breasts.
Totally.
What do you do? Like, what does
Yeah.
that look like? Because I've never known.
Yeah, exactly.
She's gonna be like, whip up your shirt when you're right
do
here.
practices right now.
You're right now.
Right? Honestly, I would start in the shower.
Okay.
Like, and I think people just overcomplicate it a bit. Yeah. Like, it's body awareness, like, of anything. If you're like, my knees kind of,
Yeah.
you're like, that's different. So it's the same with your breasts, right? If you're already in the shower, washing your hair, lathered up, it's easy then to just, you're already washing your body, like, feel around, right?
Okay, but I want to get like real, like
Yeah.
granular here.
Yeah.
Like when you're saying feeling around,
Yeah.
are we like, is there any direction?
Yeah.
Are we like massaging? Are we
Yeah.
like just giving a good nice grope?
Yeah.
Like
Yeah.
this is the part because
Are
sometimes
we
I'll be
mammogram squishing?
pushing, like what's happening?
Yeah. So the best advice is to follow a consistent pattern to make sure you do it the same month to month and that you cover all the areas.
Okay.
Right. So whether that's circular, that would be a good place to start.
Palms.
Okay. Then when we talk about pressure,
Okay.
we want to use different types of pressure because different types of pressure will find things in different layers of tissue, right?
Okay.
Like more firm pressure is going to go deeper tissue, lighter pressure is going to go more surface level. So probably once around with light pressure, once around with harder pressure. And then like you do want to look at yourself naked.
Yeah.
Right?
I mean, I
Like,
love looking at myself naked. So like we're already there.
But
I'm
so many people probably don't.
Oh, that's me. I'm like, if
Oh my
you
gosh,
guys
I walk
ever
around naked all the time.
This girl loves to be naked. She's now on a farm and she's like,
Oh my God.
welcome to my kingdom.
Oh
The
my
queen
God.
has
I'll
arrived.
like come out after a shower to talk to Nick and he'll be like,
Oh
you're
my
just naked. And I'm like, I'm going to bed now. Anyway, sorry, keep going.
Oh my
Not everyone
gosh.
is as free as me. I understand.
No.
It's great.
But you said
It
look at
is
yourself-
great. It is great.
Well,
If you guys ever watch Arrested Development, okay, so like
Yes.
Tobias in that show is a never nude, right? He wears
Yeah.
like cut off shorts in the shower. Like
Yeah.
I'm like one step away from a never nude.
Okay.
I like hate being naked.
oh man.
I know. So like for me, I'm like I'm not checking things out, right? I'm just like whoop, dressed, whatever.
Yeah.
Okay. So, but that becomes an issue too, because like if your nipples are inverted, if you're having like some kind of discharge from your nipples, those are all early signs of breast cancer, right? And it's not just breast cancer; it's like ovarian, cervical cancer too, right?
Right.
If things are changing in your abdomen, then for women, that's like the only way to detect it is through your symptoms.
So what would be changing in our abdomen?
Like bloating,
Okay.
fullness, changes in your bowels, painful sex, like anything like that is.
Okay, so then how do we not? Because you've just said a couple things and I'm like,
That's
I know.
Check.
I'm like,
check. Well, not the last one.
Yeah.
We're still good there.
Yeah.
But I'm like, I'm sure we now have listeners who are like, oh my gosh, I'm bloated. I'm not going to the bathroom.
Totally.
Like what would you say that like if you have like 3 or 4 of these symptoms, like you should go get checked out?
I think if something's changed, you should go get checked out.
So if we're like chronically bloated, you're like,
Yeah.
oh, okay.
And what does a checkup look like? So we're obviously going to our doctors.
Yeah, your
I know
GP.
this sounds so. We're like step by step,
No,
hold
no.
our hands to get there, you know.
No.
But I think so many people don't know the steps.
Yeah.
And if like your parents didn't do it, like you
Yeah.
know, and people aren't talking about it, you're like, what does that actually look like?
Yeah.
What am I asking my GP?
Yeah.
What screening am I
Yes.
looking for? You know, those
Yeah.
type of things.
Like my parents, and still, they like never talk about health.
Yeah.
They're like, someone is sick. It's like, what does that mean?
you're like
Yeah.
define sick, and they're like, no, they're just sick.
They're ill.
Yeah.
You know, like what? Okay. So for a lot of us, we're just like kind of figuring this out on your own. The trouble is, absolutely, you need to go to your GP.
Okay.
Right? The trouble is, especially in younger women, things get dismissed really quickly.
Yes.
Which is, again, archaic because people say you're too young for it to be anything serious. You know, like that's total
actually not
lie.
true.
It's
Yeah.
not true at all. Like we know kids get cancer. We know teens get cancer. Like that's just a bold-faced lie. So I don't subscribe to that. You know, like you need to have a GP that you trust and you like, and that's not an easy feat.
I was going to say that's very hard.
It's
in
not.
our system.
Yeah, it is.
Would
Yeah.
you say it's, and I don't want to start anything here, but would you say it's like important for like women to have women doctors? Like, do you think that there's a difference in the way that that is taken seriously?
Yeah. I don't think you're starting anything. I think we have literature to show that's true.
Well, I'm like,
Okay.
yeah. CJ and I was like, we love men. Okay. Yeah. We love men. We believe we need them.
Yeah.
But I'm like, I can appreciate that like a female doctor might be more like, if this was me.
Yeah.
Right. Like
Yeah.
I would.
No, don't get me wrong. There are some female doctors that are dismissive too.
Yeah.
Right? Like, stop whining. It's nothing.
Yeah.
Right? Totally.
Yeah.
But we have literature to show that female surgeons get better outcomes. Right? Like, there's qualities about females that make them better. And we have the literature to show that. So it's not like opinion or bashing
Yeah.
men. It's the truth. Like,
Okay. Okay. So going to our GP, how often are we needing to go and get checked?
You
For,
know-
like cervical cancer, for instance.
so if you're under the age of 40
Yeah.
and you have like no other symptoms, no reason to go, I don't think you need to go all that often. Okay. And when you start becoming over the age of 40, that's when we start seeing recommended screening. Now, if you have a family history of cancer, like if all of your aunts have had cancer, this needs to start sooner.
Okay.
Right. And so you probably need to start more around the age of 30 because that's just the reality of your family history. Right. And it doesn't make it good or bad. We're just like being extra vigilant for
Yeah.
you. But most screening guidelines are going to start around the age of 40.
Okay. So other than our symptoms, so okay, you said that for women, how did you put it? Like we can only by our symptoms. Oh, you said it right at the beginning.
Yeah, you can only detect it through your symptoms, like ovarian cancer.
Okay, so is there a difference in men for their cancers? Now, maybe you're not as much into the male cancers.
I'm not.
Okay, because I was gonna be like, is there a difference? Like, I was like,
Yeah.
do men
Okay. Let me
experience,
give
like,
you an
pain?
example.
Yeah.
So for prostate cancer,
okay, that's what I
Okay.
was thinking of.
totally. For prostate cancer, we can measure a PSA. So it's a blood level. And if your PSA rises by a certain amount, then we better do further investigation to see
Okay.
what's going on. For ovarian cancer, there's nothing concrete like that. We have a blood test called a CA-125 that's really vague. It can be elevated for lots of reasons that are not cancer. And if it's elevated, it doesn't necessarily mean that there is cancer. So it's essentially like a tool, but it's not a screening measurement that like you could get every year.
Yeah.
It just is not
Okay.
reliable. So for men, we have something super reliable. For women, we don't really have anything.
What about for breast cancer? What's the MTF, or is that a gene?
That's a gene.
Yeah, okay.
Yeah. So for breast cancer, we have mammograms.
Yeah. Okay.
That's it. It's like either self-exam or it's mammograms.
Which, what are the top types of cancer that women are getting?
So the most common is
Yeah.
breast cancer.
Okay.
We see that in the greatest number of women being diagnosed.
Yep.
So that's the one thing, like the greatest incidence. But we also have to look at survival rates, right?
Okay.
So if you are diagnosed with cancer, like what are the outcomes of that? So breast cancer, we have the highest incidence, the most women.
Yeah.
But they also have like typically a great prognosis.
Okay.
Right? Like
Right, because I mean, from what we heard with our guest on, that even a stage 4
Yeah.
isn't necessarily a death sentence
No.
anymore, right?
No.
Like it's like science and medical practices have become so far that it's, while super scary, and I would never say that it isn't terrifying, that yeah, the survival rate is quite high.
Yeah. Like if I think about the patients I've had that have been stage 4 breast cancer survivors, they've lived for years, like
Yeah.
years. So it's really needs to shift. Like we have this idea in our head that cancer is such a death sentence.
Yeah.
Right? Because like the media portrays it like that.
Yeah.
Yeah.
Like every gosh darn movie, when someone dies, it's from cancer. Like there's a million ways to die and it's always cancer.
Yeah.
And it's just like, that's not necessarily reflective.
Right.
And yes, there are some people who get diagnosed and die really quickly. That happens.
Yeah.
But for the majority, we need to start shifting our thinking to it's more like a chronic disease that can be
interesting.
managed over time. Right?
Interesting.
Yeah.
Right. That is actually a very different way to think of it, because I think even me sitting here, I'm like, cancer's like the
Done.
worst of the worst. Like that's the last thing you want to hear. But hearing it compared to as like a chronic disease, because I mean, we know people who have lived with their diagnosis for a really long time and they're doing really, really well.
Yeah.
Right? That's interesting.
Like, can you just imagine if you get diagnosed and you are like hitting up your bucket list and blowing your savings, and then you're like, oh man, 7 years later, I'm still here.
Yes.
You know? So like that's what's happening with a lot of women, right? So for
Okay.
breast, there's longevity there still. It's still scary, still traumatizing, but could be a long time.
Yeah.
We would expect that. Now, for other cancers, like if we go to other female types of cancer, so ovarian cancer,
Yep.
that is less common, but a worse prognosis.
Yeah.
Okay.
Right. The most common type of ovarian cancer, if you were diagnosed, so let's compare it like stage 3 ovarian, the survival rate's just a little less than 40% at 5 years.
Okay.
So if you think about how old you are now, 5 years from now, you have a 30% chance of making it there.
Wow.
Like that's not great.
No.
Right? So we get a lot of funding and attention on breast cancer. And there's a lot of controversy around that as well.
Why?
Just like the pink aspect of things and pink washing of things. I don't know if you guys have ever heard.
No, I want you to go into that a little bit. It's
Kind of strange to do it in like a pink group.
No, it's okay. We're not. I love pink. I'm not like. It's all good. We're
not offended.
Not offended.
So, with Breast Cancer Awareness Month being
Yeah, it's like
October,
all pink.
Everything's
Yeah,
pink.
everything's
like
pink.
football players are wearing pink. Like it's.
Hey guys, it's CJ. Quick question. Do you ever feel like you're juggling too much as a female entrepreneur? You are not alone. Erica and I know that struggle all too well, which is why we co-founded Carousel Media Management. Yes, you heard that right. If you didn't already know, we own another business together, which is Carousel Media Management. At Carousel Media, we're dedicated to lifting the weight of social media strategy and content creation off of your shoulders. Imagine having more time to focus on what you love in your business while we handle the ever-evolving world of social media. Here's the deal. Carousel Media offers boutique social media management services specifically for busy entrepreneurs. Our goal, to amplify your social presence, save you precious time, and help you reach your marketing goals. If you're wondering, why would I need a social media manager? It's simple. While understanding the importance of social media is crucial, dedicating the time to becoming an expert can feel overwhelming. That's where we step in. With Carousel Media, you'll have a team passionate about propelling your business forward on your social platforms without the stress of doing it all yourself. If you're ready to take your social to the next level this year, slide into our DMs at Carousel Media MGMT on Instagram or click the link in our Instagram bio to book a free discovery call. You can also visit our website, Carousel, Carousel, media.ca for more details. And don't worry, it's all in the show notes for you to click.
There's pink everywhere.
Yeah, yep.
There's pink ribbons on your bananas, on Kleenex boxes.
I
like,
know. I always thought it was weird, all the breast cancer stuff in gas stations. Like, like scrapers for your car. And they're like pink with this like symbol on it. Yeah. No.
So there's one camp of people that will say like, that's great. It's bringing like a tremendous amount of awareness. Like you can't get through October without knowing it's Breast Cancer Awareness Month.
Yeah.
There's another group of some breast cancer survivors who are saying like, this is pink washing. So pink washing is basically taking a pink ribbon and slapping it on things
Yes.
that could potentially increase your risk of breast cancer.
Oh, okay. Yeah, I get
So
it.
you get a pink ribbon on a bottle of wine. Well, we know wine increases or alcohol increases your risk of cancer.
I want to
it's
come
like-
back to that.
so we're like, okay. Or like processed meat increases your risk of cancer. So this past October, I was approached by a company that sells beef jerky. And they're like, will you promote our beef jerky? And I was like, are you guys flipping kidding me right now?
Like they just don't even know.
yeah, like they're just not
Do you
even
think
aware.
it's, I was going to say, like, do you think it's like an unintentional thing? Like some of these brands are like, I actually don't know that my product does. I mean, I think we could always argue like maybe you should research that. But do you think there's people who are genuinely trying to be supportive and then it's coming off like that's actually not good for cancer?
I think there's a spectrum, right? I think there are people, like probably smaller businesses that are like, I'm just trying to do something
Nice.
nice, right? And then there are bigger companies that will say, plaster it with pink and say we're going to give 10% of the proceeds to what? Like sometimes they don't even say. Like who
Yeah.
is the money going
To breast cancer research.
Right. What does that mean? Right. Who is it going to and how much? And if you're a multi-million-dollar company, 10%, I'm sorry, is not good enough.
Yeah.
Like I'm not donating to someone who gives 10%.
Yeah.
So like step that up, make that better because you're benefiting from the marketing aspect.
Yeah. Yeah.
Yes.
Right. So then you need to donate more than 10%.
Yeah.
Yes. 100%. That's insane.
I want to hear about products, items that increase your risk of cancer because I
Yes.
think you listed 2 that I had no idea about. I think of sugar, but apparently,
Yeah.
is this a myth? Like, like I've always heard sugar like feeds
Soy.
cancer.
Yeah. Yeah.
So I want to hear some of these myths or like maybe
Truths.
products that a lot of us have in our houses that
Totally.
might be
Totally.
increasing this.
So if I were to look at the clear science, like clear science that we have associated with things increasing the risk of cancer.
Yep.
Like I've got to say tobacco.
Yeah.
Okay.
Like, I mean,
Yeah.
if anyone hasn't
Yes.
heard that in the last 50 odd years.
Yes.
okay?
Yeah. Yes.
But whenever I go through this list, people are like, you didn't say tobacco. It's like, well, you don't need me to. Do you
Yeah.
really need
Yeah.
me to say that?
Yeah.
Except people do because they're gonna be like, I can go smoke now.
Don't do that.
We heard on the Her podcast.
Stop smoking.
The mess. Stop smoking.
Yeah,
got
please
it.
do. Good God. Okay, so that's the first thing. Now, the second thing, it's a little bit more troubling because it's
Okay.
ingrained in us
Oh my gosh,
socially
no, I'm so scared.
and culturally is alcohol,
Oh,
right?
okay.
Yes.
Gosh, that's a tough one, right? Like even for me.
Well, and it is kind of weird, and we've talked about alcohol a bunch on this podcast, but we're like, it is like the most normalized, like bad thing.
Well, and even like you
ever.
know, female culture, right?
Yeah.
Yeah.
Wine mom
Yep.
culture, right? And like it infiltrates both sides and
Yeah.
both genders, but
Yep.
just how socially normal it is
Yep.
to drink. And when you don't, the sort of like, well, why aren't you? You know, and for females, are you pregnant? Is there
Yeah.
something wrong? And it's
Yeah.
like, you know, although I do think that there is a wave, which we've talked about on the podcast about like sober curious,
Yep.
right? And
Yep.
people that are really stepping
like
into,
that.
which we are as well,
Yep.
right? And just getting on that not bandwagon, I don't want to use that term. Getting on
I think people are reevaluating.
Yes.
I think people are
Yeah.
reevaluating, and like the more and more science that's coming out about what alcohol does to your body, I think more people are like,
well, it's not
they're
helpful.
starting to treat it a little bit more like, yeah, that's like something I'll partake in
Yeah.
once
Yeah.
in a while.
Yeah.
And I don't know if this is science, but like it seems like, you know, alcohol could be the new tobacco.
Yeah.
You know,
It
could
really
be
does.
the route that we're going.
It's starting to come out like that more and more. And it's tough because when we talk about alcohol, like people have fun
I know.
when they drink alcohol. It's like, it's fun. It tastes good. Like, so people are like, what? Like, come on. And for a lot of us, if you grew up in small town Saskatchewan, this is like lunchtime.
Yeah.
You know?
Yeah.
yeah, it's ingrained in the culture.
It's ingrained in us culturally, and we see that in our drunk driving rates. Like we see that locally, widespread.
Yes.
But here's the silver lining. Here's like the reassuring part for me is that we know as women, like we're gonna drive the bus on a lot of these things, like within our families.
Yes.
So if we change our eating habits, our drinking habits, our exercise habits, it's said to shift the direction of your family for 7 generations.
Get out.
yeah.
Okay,
Isn't that
hearing like
amazing?
science behind it is so helpful.
Yeah, it's like so empowering for me, right?
Say it
Or-
again.
Or like as women, right?
Yeah.
Yeah.
Because it's like, man, if, you know, you could look back and say like, my mom never exercised. Like, I'm not speaking about, my mom's quite physically fit, but like my mom never exercised. My grandma smoked. They were all drinkers,
Yeah.
you know? But if I change this direction, then like my kids and their kids and their kids, like
Yeah.
it shifts it for everyone.
Yeah.
Dang.
I could see
Yeah.
that. Okay, so alcohol. So we have tobacco,
Alcohol. Okay. Now, if we're going to talk about the thing that really increases your risk of cancer, it's inactivity.
Yes.
And
Okay.
like being sedentary.
Yeah.
That's a big one.
Why?
So exercise or being physically active, there's a few theories around why it lowers your risk of cancer.
Okay.
One's around insulin resistance. So it'll help with that. The other is around lowering inflammation in your body.
Okay.
So we know like over a longer period of time, exercise will lower inflammation in your body. So there's really the 2 theories right now around exercise and cancer. So a lot
Get
of
moving.
yeah, a lot of people think they need to be like a fitness freak.
Right.
You don't. Like you really don't.
Yeah.
if we're going to get to target exercise rates
Yeah.
to lower your risk of cancer. Okay, so this is my favorite stat.
Yeah.
Is
hit
that
us.
if we hit to target exercise rates, you lower your risk of cancer by 59%.
Get out. And what is the target? Tell us about
It's
the target.
really like not that crazy.
Yeah.
Okay, so 150 minutes of low intensity cardio per week.
Yeah.
So like walking.
Walking. You could walk.
Okay.
150 minutes. That's like nothing.
It's not very much.
Yeah.
Okay.
Well, but I also am on my treadmill every other day. So for me, I'm like that. I would do that in
Yeah.
like
Probably
that's not a
Monday
problem.
to Friday you get
Yeah,
that
I'm like
done.
that's
yeah.
like not a problem.
Yeah.
Yeah.
Okay. So that's number one. Number two, the second part of this is strength training.
Yes.
We have to have like some aspect of strength training. So it can just be body weight strength training.
Yep.
But 2 to 3 times per week for 20 minutes at a time.
Yeah.
Okay. Like
it's
turn
not-
on a show and lift some weights. Let's go.
Do some lunges, wall push-ups, like whatever you want. But we need to incorporate some sort of strength training. And that's it.
I'm interested why the strength training.
Yeah. A lot of people ask that question.
Yeah.
Right. I guess a question back would be, how come we don't ask that same question about cardio?
I don't know because I think cardio, like I immediately think like heart health,
Yeah.
right? Like which maybe isn't
Well,
accurate.
and I think there's like a shift in the environment from what I've seen in like health and wellness,
Yeah.
you know, is like weights and
Yeah.
strength training,
Yeah.
especially around women, was
Yeah.
like not happening.
Yeah.
Right. And like now, I think you can speak to this more than
Yeah.
I can. Fact check me. You know what I mean? But
Yeah.
I'm like, it seems like the science is coming out now that, you know, weight and strength training is so important for women as well.
Yeah.
Right. And it's like your bone density, like your longevity.
Right.
Right. And so I imagine that it helps with
Yeah.
all
Yeah.
of your organs.
That's funny because I've never asked someone that question back to them. I've never been like, tell me why you think that.
Yeah. I mean,
So
I
I
like
was
strength
interested to hear what you
training.
say.
I think on what CJ has said, like strength training for me has always felt like, like I'm getting stronger.
Yes.
Right. Like I'm building strength. So I guess when I think in terms of cancer, I'm like, I don't know. Maybe I feel like with cardio, I'm like, you're like circulating your blood flow and you're like getting
Yeah.
everything moving. And when you say strength training, I'm like, am I like making my little like blood cells stronger? Like what's happening here?
Picture this. Picture this. Like you're 98 years old in a nursing home, like bragging to all your great grandkids about how you lived through the pandemic, right?
Yeah.
So how do we get to that point,
Yeah.
right? Because like in our culture, rightfully so, we really prioritize long, healthy lives, right? We're not like live fast and hard and die,
Yeah.
right? We're like live long and be healthy.
prosper.
Yes, exactly. So how do we get to that point? And really the answer is after we hit menopause, we start losing muscle mass.
Yeah.
Ooh, that's like scary, right?
Drastic.
Yeah, it's
and
scary.
hard to gain muscle.
Because in your 30s,
after.
that's really your last kick at it to like put muscle mass on your body.
Okay.
So if we want to live long and be strong and healthy at 98, then we need to have muscle mass on our bodies. Because that's how we're going to do our whatever, carry groceries, open doors, go to the bathroom, like all that stuff. So if we're talking about long, healthy life, then we have to associate it back to strength
Well,
training
and I think it was Dr. Peter Attia that I've heard this from, you know, and he said, think about your life where you want to be, let's say at 98 or 100 and work your way backwards,
Yeah.
right? So like,
Yeah.
do you want to be able to pick up your grandkid?
Yeah.
Well, you know what that means? That at 30, you have to be able to lift this amount
Yeah.
of weight
Yeah.
because this is the progression of
I love
what's going to
that.
happen, right? Or do you want to be able to get yourself out of a chair? You know what I mean? Or like lift your groceries or like walk around the house, you know, like we don't think about, we actually need to be at a more active rate now because it is going to naturally progress and go down. But I really like the point that you hit on that I think that people really need to hear, especially women, is that in your 30s is your time
Yeah.
to build your muscle.
Yeah.
Right. And you can build it afterwards, but I think it's probably, you would
Yeah.
say, a lot harder and a lot more effort.
Yep.
And we're going to lose it. But how important it is, like, I think women need to hear more.
Yeah.
Strength training in your 30s is so important.
Yeah, absolutely is possible post-menopausal.
Yes.
It's just that you just you're like kind of handed a great opportunity in your
Yeah.
30s
Yeah.
where you still have lots of estrogen
Yeah.
in most cases. You can make a big impact now, right?
Yeah.
And so I think like for me when I like think about how I feel physically when I say that, I feel like pressure.
Yeah, which is not the intention.
No, not necessarily, but like a little bit of pressure
Okay.
might be okay too
Yeah.
to be like, okay, like let's
Get
go.
going.
Yeah.
Yeah. Okay, so we have tobacco, wine, fitness.
Yes. Those are really the three big ones. Okay.
Okay.
Now we need to talk about processed meats.
Yes.
Yeah, I'm
Okay.
so interested in this because I love me a sandwich.
Oh,
so
yeah, me too, right?
I love sandwiches.
like a ham and cheese.
Oh, like
yeah.
on a croissant.
So, processed meat, we know there's a clear link between increasing the risk of cancer.
Why?
That's such a good question. So, lots of belief that it's because of the nitrates in it. So, people will buy nitrate free meat. That's never really been proven fully. So, we kind of have this like question mark around that. Is it the nitrates or is it something else?
Like how it's processed.
Yeah, something we're missing.
Okay.
Right? So when we look at the literature around processed meats, it is mainly red processed meats. So like beef, pork, that would be like a red processed meat, right?
Okay.
So like ham. Okay. Or
I was like, don't say no. You're like, ham is okay.
yeah, no. Bacon, right?
Yep.
Like I love a hot dog too every once in a while. That would fall in that category. Less common with white processed meats, so
like
turkey,
turkey,
chicken, fish.
Okay.
Okay. And hey, like I'm not saying you can't ever eat it. Like would be silly.
Yeah.
And I don't subscribe to like food rules or depriving yourself.
Yeah.
So for me, like I still love a sandwich.
Yeah.
Like who wants to live the rest of their life
No.
without bacon?
Yeah.
Yeah.
Like but here's the difference. It's not like a Monday to Friday.
Yeah.
We see so many people packing a sandwich every day and going to work, right? Processed meat every single day. Okay. We're like once in a while have it.
So
right?
like me putting pepperoni sticks in my kids' lunches every day is like a no-go.
I would not.
But then what do you do?
So such a good question.
Because
Okay.
even as we're sitting here, I'm like thinking about this. I'm like, I like love.
You're like, if I remove this
like if
out,
I remove this out and I can't put in, and then I was like, I'll just put like farmer sausage. I'm like, that's processed meat.
Yeah.
So I'm like, what do you do in these instances?
Yeah.
Because I know we have a lot of women and moms who are maybe thinking this right now. They're like all in their cars being like, how am I not supposed to
you're
give
like
my
a
kid?
ham sandwich?
Yeah, and like I know we're not giving up charcuterie any day here,
No,
but
right. Yeah.
how do we like? What is a good alternative?
Yeah. Can you prepare meats and use those instead?
I guess.
It takes more effort.
Yeah.
Okay. But you can put a chicken in an instant pot and have a bunch of chicken.
That's true.
You know, or even at the grocery store, like you can buy shredded chicken. You can buy rotisserie chicken at Costco.
Yeah,
right?
that's true.
Like this is not processed meat. It's just cooked. That's different, right?
Yeah.
So you could go more that route. A pepperoni stick, this is just hard to replace. That's just hard to replace.
Okay. Well, then that makes me feel better hearing like it's just hard to replace.
Yeah.
Well, because I think this would go into the sort of, when we go from vegans, right? Which is totally fine,
Yep.
and eat it, it's like,
Yep.
I want a hamburger, but I want it vegan. And you're like, it's hard to replace.
Yeah.
Like, you know what I mean? You're creating something different,
Yeah,
kind of, right?
Like I could make a vegan hamburger,
Yes.
but it's never gonna be
it's
the
not a
same.
hamburger.
No.
Yeah.
And I'm not knocking it
Yeah,
anyway. I'm
totally.
just saying it's
Totally.
like, it's different.
Yeah,
you
it's
know?
different. And I think, but that's the key. If you wrap your head around like this is different, right?
Yeah.
Like I'll make like high protein brownies.
Yes.
Okay. And people are like, these taste terrible. And I'm like, yeah, because it's not a brownie. It's not a brownie. It's a high protein brownie.
What are you
right?
putting in it to make it high protein?
Oh, like egg whites, cottage cheese, protein powder. Yeah, those are the main ingredients.
Yeah.
Oh my gosh, you should send us that recipe.
Oh, it's so good.
Yes.
Okay, but you got it with the same idea.
I don't
it's
like
not a
brownies
protein.
though. So
Or-
I don't like
yeah.
brownies.
Yeah.
So I think I will eat this
Yes.
and be like,
oh, it's so good.
we're fine.
It's
Because
so
I'm
good.
already like, brownies for me are kind of overrated.
Whatever.
So,
Yeah.
I want to ask about sugar.
Yes.
Yes.
Because I feel like this is a big one that I've like heard over and over again that like sugar just feeds cancer.
know.
Like get rid of all the sugar. I mean, sugar. Right.
It's
Yeah.
feeding something.
Yeah.
Yeah.
Feeding something. So I'm curious about that one.
Okay, so this is interesting because as a cancer survivor myself,
Yes.
when I was diagnosed, I went to this gym where this, when you go to a gym, there's always gym folk around that There was this older man that would go to this gym too, and he worked nothing in healthcare, like nothing at all. He was like an IT guy, maybe, I don't even know. And he really shamed me after I was diagnosed. He was like, you shouldn't eat sugar. Stop eating sugar. Like you're fueling your cancer. So someone with no knowledge and like no right, pushing their beliefs on people. Oh, that just makes me
Well, you're like, I didn't ask for your advice.
didn't
buddy.
ask for your advice.
Yeah, thanks.
Okay. And that happens to cancer survivors like over and over again, right? like what they should and shouldn't do.
They get shoulded on.
Of this culture that we have that's like moving away from food rules, right? We're totally moving away from food rules in general. Cancer survivors are getting it like 5 times.
Well, I never said anything, but I remember I went and saw my friend a couple years ago. She's a breast cancer survivor, and I went to go see her, and I brought her a Starbucks. And then after I like read about sugar, and I was like, I'm killing her. I was like, do I say something? Do I be like, but I was like, I'm just gonna leave it because I think she knows probably more than
Exactly.
I do.
You have to trust that she is
like,
doing
you
the right
said yes.
thing. Yeah,
But I remember being like, I'm sorry. I'm so sorry.
Oh my gosh. Okay, I'm not dodging your question about sugar though.
No, it's
so
fine.
back to that.
I want to hear it.
So
Hey, it's CJ here with a game-changing tool for your social media. Ever find yourself in a social media panic where you're wondering, what am I going to post next? Or maybe you're tired of the last-minute scramble for content ideas. I've got a solution for you. Eric and I are super excited to share our latest creation that we have put together over on Carousel Media Management. It's a free content calendar, and it's designed to transform your content strategy. Yes, you heard that right. It's absolutely free. Why a content calendar, you ask? Because we know the power of planning. With this handy tool, you'll be able to say goodbye to content nightmares, like not knowing what to post, panic posting, or the I'll just post something, I guess, strategy. The content calendar is perfect for those who love a good old-fashioned pen to paper approach, helping you map out your posts for the week or month with clarity and confidence. Ready to grab your free copy of the content calendar? Well, head to the show notes for the direct link. You can also snag it on our website at Carousel Media, CAROUSEL media.ca. And you guys, for on-the-go social media and marketing advice, don't forget to follow us on our other business page, which is at Carousel Media MGMT on Instagram. Happy planning, friends.
So sugar, there is a widespread belief about that. Sugar has never been shown to increase the risk of cancer, like sugar on its own, okay? So I'm not saying sugar is good.
You're not like go eat all the like licorice and all that ice cream
it's
and
not
crap
good
you
for
want.
anyone.
Yeah.
Right? Ever. Like to eat copious amounts of sugar, never. Okay? But if you want to have ice cream in the summer with your kids, if you want to have dessert at Christmas supper, like you should be able to do that without being worried you're causing cancer.
Yeah.
Well, and it's probably a bit like, again, moderation. And it's like, listen, like sugar, too much of anything can lead to health problems, which maybe the health problems increase your chances of cancer.
Yes.
So it's like,
Yes.
we're not sitting here being like, you eat this chocolate bar and you're diagnosed with cancer. And we're like, here's the direct correlation. But you eat all this junk all the time, you're gonna have health problems down the road.
So here's to tie into that.
Okay.
We do have literature, and this is hard to hear. Okay. Even for a cancer survivor myself, we have literature to show that women who are at a higher or unhealthy body weight, they have a higher risk of cancer. Okay. So as a cancer survivor, like I gained 20 pounds during my treatment, like easy. And I know your past guest that's been on, I think she gained 35. Like it's really hard. And then
wait, so if you are of an unhealthy, what can we use this term? Because I don't want to do any like
we have to go
overweight.
with BMI because that's like the most widespread. It's got its flaws.
Yeah.
Okay. But we have to go with that.
Okay, so
I
like-
don't use BMI. I just say like, where did you feel healthiest? Right? Like you tell me.
But then you also gain weight during your. So then they're like, you're
Oh,
at
shoot. Yeah.
you're at a higher risk of having cancer if you're overweight.
Exactly.
And now I went and gained 35 pounds
Yeah.
while having cancer.
Yes.
Okay.
Great,
Oh, that's
great.
really
Okay.
confusing.
So you mentioned like sugar leading into other health problems. So when we look at sugar causing cancer, is it sugar or is it that you eat a lot of sugar, you gain weight and the increase in your weight causes cancer, right? Because carrying around extra weight is going to have inflammation. It's going to have troubles with your insulin regulation. So like we know those things are attached to cancer. So that's kind of where I draw the line is I just say, hey, look, like we know cancer survivors who are told like sugar fuels cancer. We see case studies now of women who have never had eating disorders before, diagnosed with cancer, told these rules, and now they have eating disorders.
you should go into this because
Right.
that's probably something that people are not thinking about.
Well, because I'm sitting here even personally, and
But
I'm
I'm
like,
like, I am
have to lose
understanding.
weight. I'm like, I gotta lose weight. I'm like, I'm walking on the treadmill. We are running tomorrow. We are lifting weights.
Yeah.
Right. And now, you know, you don't want to fuel fear
No.
Yeah.
that drives someone into this. But
Yeah.
yeah, I'm very interested to hear about this.
Yeah.
Well, and even like post treatment,
Right.
right. Is what you're saying.
Yes,
Is people walk out
post-treatment.
and they're so scared.
Yeah.
And so now they're very restrictive, I'm
Yeah.
assuming.
Yeah, exactly.
Right?
They try not to eat anything that could cause cancer. So every time they go to eat something, they're like, "Oh, is cheese safe? Is pepperoni sticks safe? I can't have this wine? Okay, should I not eat meat? Okay, but I heard someone say no vegetables, that you should only eat keto, and now or carnivore, and now it's just like, oh my gosh, so I'll just eat nothing." And then there are some women who drop a tremendous amount of weight. And that's not healthy either, right? Because you're losing fat, but you're losing your muscle too.
Which you need to prevent cancer. Oh my God.
know.
That's a spiraling.
So instead, like, focus on what you are doing
Yeah.
to lower your risk of cancer,
Yeah.
right? Like in your case, you're walking every other day, you think? you
Every
said?
other day right now.
Every other day. That's progress, right? That's huge progress. Okay. So if we look at foods that you can eat to lower your risk of cancer,
Oh, tell us about those.
which is actually where I like to spend a lot of my time.
Okay.
Yeah, I feel like
Rather
that's
than-
less restrictive. It's actually more like inviting.
Yeah.
It's like, let's open up this.
Exactly.
Yeah, I like this.
Because
Okay.
I feel like there's better literature to show like we can actually fuel our bodies, like
Great.
fuel our bodies in healing and recovering from cancer.
Yes.
Okay. So if we were to look at what we need to eat to lower your risk of cancer, so like forget what you need to avoid, just focus on what you need to include. Okay.
Great.
So we need to be eating way more vegetables than we are. So
Like eat the rainbow.
sure. Yeah. I like that. Okay. But if you think about your dinner plate, half of it should be vegetables, right? And we need to do that 3 times a day. Okay. Or you could do like 2 cupped handfuls of vegetables. Like it's a lot.
Yeah.
Like I could go until supper without eating vegetables some days, right?
Yeah.
And so we need to just up that
Okay.
a lot. Okay. Now, we also know we need to focus on lean protein. Okay. Now, you can do that if you eat animal products or not, but still, culturally, we don't eat enough protein, especially as women.
Yeah. I feel like that's the theme of our podcast.
Not enough protein.
Yeah.
Because
I'm
it's
about
like
it.
not carbs are delicious
And easy.
and fast.
yeah.
So we just don't eat enough protein.
Okay.
So that's the second thing that we need to
Increasing
focus on.
protein intake.
Yeah. Yeah.
And when you say lean protein, what do you mean?
So poultry is always a good option.
Yeah.
But we can also go plant-based proteins too, right? Like black beans, chickpeas. We could do something like that. I would try to start including protein at every single meal you're eating. And sometimes that doesn't always happen. So I would start there.
Okay.
Yeah.
So what are you eating as a cancer survivor and as someone who is clearly like cancer is, I don't want to be like cancer is your life, but I'm like, you're quite
Yeah.
immersed in it.
Yeah.
I'm curious what it looks like you're eating like for breakfast to get
Yeah.
protein and to like incorporate veggies because
Yeah.
I feel like I can sit here and be like, okay, I can easily have like protein and veggies at lunch and dinner. Like that's very easy, but I'm someone who like struggles to eat in the morning.
Yeah.
So I'm like, how are we incorporating this into our breakfast?
Yeah.
And as busy moms
Yeah.
and women who
Yeah.
are like running all over the place.
Yeah. If you don't want to eat in the morning, you don't have to. Like you don't have to do that if you don't want to.
Listen to your body
I
cues.
know.
Eat when you're hungry.
What's that?
Listen to your body cues.
Yeah.
Like eat when you're hungry.
Yeah. If you don't, like if you're like, I don't like to eat a big breakfast, don't.
Okay.
Don't
But
do
I
it.
want to know what you're eating.
Totally. I do like breakfast. Okay.
I mean, I like waffles and whipped cream and strawberries. Yeah. Like I like me some like OEB breakfast. When someone's like made me a eggs Benny. Like that's great. But I'm like in my kitchen. I'm like freaking oatmeal or something.
Yeah. So I toggle between 2 options.
Okay.
So the first is oatmeal.
No,
it's
I
like
know.
overnight protein oats.
Oh, I like overnight oats.
So I'll
Forget
do
about
oatmeal,
that.
protein powder, and then whatever is in my fridge that the kids aren't eating for like scrap berries usually. They go on top. And then I usually like to add a little fiber. So I really like a crunch. So I put bran flakes on top, bump up my fiber. That's one option.
Okay.
Okay. Second option is I'll do like an egg white omelet with a bunch of veggies and spinach.
Okay.
And then some mozzarella cheese in there, some salsa. That's good too. Okay.
Cottage cheese in your
cottage
eggs.
cheese, totally. Have you ever tried that?
Yeah.
In
so
your
good.
eggs.
Yeah. You can like mix it
Like
in.
I'll just eat cottage
Oh,
cheese.
that
Yeah.
too.
Except I'm on like this like no dairy thing.
Yeah.
So like
You know Monica Groney from
Yeah.
Maria? We had her on the podcast. She did like a whole series on how to increase your protein intake for like women, and she has like lots of recipes, and one of them was like eggs and
Yeah.
cottage cheese, just like
It's a
mixing it in.
serious bump in
Yeah.
protein.
Yeah.
Yeah. Don't like lots of people are like cottage cheese is so gross.
I love cottage
Okay.
cheese.
Like, you know, the texture, some people are just like, okay. But you can like hide it in so many places.
I eat it
Brownies?
with a spoon.
Oh, me too.
Like I'm like a little salt and pepper, or when we do raspberries and
straight-
cinnamon,
oh,
like
yeah. I like it
Right?
too. Yeah.
I really miss cottage cheese.
Yeah. So those are my two high protein or my two breakfast choices.
Okay.
But this morning I had toast with jam.
Great.
Because that's what my kids were having.
Yeah.
Right.
Love it.
I know like for the rest of the day, like
Yeah.
I'm gonna have to like, you know, go hit up some veggies, hit up some protein.
Yeah.
Otherwise I'm just gonna feel terrible.
Yeah.
Too. But yeah, that's what my kids were having. So that's what we had.
Thank you for normalizing that.
Yeah.
The question I have is, you said that the American Cancer Society has like updated, it's self-checking?
Yeah.
Yeah. Talk to me about that.
So that happened like 18-ish months ago.
Okay.
Is that the
Oh,
American
it's very fresh.
Yeah, so the American Cancer Society, they just kind of quietly removed their recommendation to do self-breast exams. So this upset a lot of people in the community, like the breast cancer community especially, because a lot of them found their own cancer through a self-breast exam, right? So in the one camp, they're saying, you know, the literature around doing self-breast exams, it's never been shown to actually be that effective. So women don't more commonly diagnose their cancer if they're doing regular checks. So why do it? So remove it. Okay. But then there's this whole other camp that's like, well, we should be aware of our bodies, like what we already talked about.
Well, and it's like, I don't think I'm going to put words in everyone's mouths right here. Like, I don't think if I felt a lump, I'd be like, yes, I have cancer.
Right.
Like, you know, this whole like self-diagnose
Right.
thing. I think it'd be like, ooh, I should go get this checked out.
What's that?
Yeah. What's that?
Yeah.
Just like any other lump on my body.
Yeah.
Get curious.
I think I think that's really level-headed and reasonable. I think there are some clinicians.
Don't get me wrong. Like, I would probably MD it, like WebMD and be like,
All your friends.
it's a goner.
the end.
I'm a goner
Yeah.
guy.
We're spending it all.
No. But you know, I mean, maybe they're like, I'm interested that the verbiage that I think you're saying is that they're like, women aren't self-diagnosing themselves, or that it's like not proven.
It's
to,
just
like,
not effective.
It's not effective. But I'm like,
Yeah.
feels like very interesting to me.
You know, some clinicians will say we're not going to get women to do self-breast exams because if they find a lump, it's likely not cancer, and they'll get too anxious and worried.
We're already anxious and worried.
Right?
We found something
Agreed.
different on our body.
Yeah.
Please don't placate us.
Yes.
And now you're telling me not to check my boobs, and now I'm like, well, what's growing? And I'm not looking.
Exactly.
Oh my word.
So I don't agree with that ever. I think you should know your body.
Yes.
Because at the end of the day, you're the only one going home and living in it. Like, seriously, any doctor that's dismissive or someone that pushes you aside. Like, I've had my run-in with so many medical receptionists that I'm just like, I'm going to be real polite and real nice, but I'm going to be here until this gets resolved because it's my body, right?
So
and it's
what's
your
happening
life.
with receptionists? Not to put receptionists on blast, but like,
oh, sure. They're just a gatekeeper, right?
Okay.
Right. So they're just a gatekeeper to
you're trying to like
the
book an
system.
appointment, or
Yeah, we don't have an appointment for 4 months. Okay, I'll call back and check again tomorrow, and the next day, and the next day, and the next
Oh,
day.
it's like how I got my son's surgery. Is I was
Yeah,
like, my
tell me.
friend was literally like, be a squeaky wheel.
Uh-huh. But that's totally it, right?
Yeah.
It's just like you have to be persistent about
Yeah.
it. And it is tiring, you know?
Yeah.
But it's the truth. But back to your point about the American Cancer
Yes.
Society. So they removed this guideline, but like still for my patients, I'm still telling them to do self exams. You need to have awareness over your body, like whatever it is.
Yeah. And so correct me if I'm wrong, but it's like the self-exam doesn't mean never coming in and seeing your GP.
No.
Right? It's just like I feel like it's like an added layer of defense. It's like, why not?
Yeah.
Why not be checking yourself? Like,
Yeah.
it feels odd to me that, like you said, like if something started acting up in our knee,
Yeah.
right? And we noted it. Like,
Yeah.
why wouldn't we want to note something
Exactly.
about our boobs?
Exactly. Yeah.
Well, and I think like, you know, we're speaking to an overrun system and yet we're supposed to put our health
Yeah.
sort of into their hands.
Yeah.
Like that's their priority.
Yeah.
And of course I'm not like, you know,
Right.
healthcare providers are amazing
Yeah.
and fantastic.
Yeah.
And it's so sad that they're overrun.
Yeah.
But I think we know no one knows your body like
No.
you know yourself. So
and they
it's
make
so
mistakes,
important.
like just like us, right?
Yep.
There's mistakes that happen, and like that's okay.
Yep.
But we just need to be there to make sure that things get addressed.
Yeah. The other ingredient, I'm going to switch.
Yeah.
Unless you have anything else
No.
to say on that point, is soy.
Yes.
What do we have to say about
Yes.
soy?
So soy, the chemical structure of soy is that it's a phytoestrogen. So it's got a similar chemical structure to estrogen. So similar but different.
Okay.
So there was a theory for a long time that soy would increase your risk of different cancers, especially like hormonally driven cancers.
Okay.
Because it's increasing your estrogen levels. And we do know that if you have higher hormone levels, so like earlier menstruation, later menopause, you have more exposure to hormones, you're at a higher risk. There's some literature around that. There's nothing you can do about it. You get your period.
Yeah, you get your period when you're 10. It's like, sorry, like this is, yeah.
That's the deal. That's the hand you're dealt, right?
Yeah.
So soy, there's that theory that it can increase your risk of cancer. So widespread, like oncologists have told patients like don't eat soy, like avoid soy, like nothing with soy, like soy sauce, don't eat it.
Yeah.
Okay. There's been a ton of literature on this now and big studies, and it does not increase your risk of cancer. And even when we look, even in hormonally driven cancer, so hormone positive breast cancer, it does not increase your risk of cancer recurrence. And even when we look in cultures that eat way more soy than we do,
Okay.
right? Like Asian cultures.
Yes.
They're going to eat a tremendous, like we don't eat soy all
Well, they
that
eat
much.
so much
Well,
soy.
so
I
much.
was gonna say, like, when I
Like
think
soy is
about
in
soy,
everything.
I'm like,
Yeah.
Yeah.
Soy
I
don't think
beans,
I'm eating that much.
tofu,
Like,
soy sauce.
aren't edamame, isn't that soy?
Yeah,
It would be
that's what I
considered like a
said.
phytoestrogen.
Like,
yeah. Like,
right?
yep.
So I'm like, but I'm not eating those.
No.
Like, yeah.
Maybe once a month or something, you know?
Like, never, but yes. Continue.
So even when we look at that population, it actually lowers their risk of cancer. So this whole myth around soy, it is just that. It's a myth. It's totally safe to eat. It's not going to increase your risk of cancer. I actually feed my baby girl soy.
Oh, hey.
When my sisters come over for supper, I'm like, we're eating edamame. I'm saving all of you from breast cancer. Like, have this food. Like, I'm shoving soy at them because I'm like, let's get this in because we don't eat it as North Americans, but we know it can lower your risk. So I definitely will push that agenda.
So is this just like, I think what's so interesting, and I get it. I understand that, like, I think what blows my mind is the like 180 on things, right? Because you're like, how did we go from
Yeah.
everyone being like, don't eat soy
Yeah,
because it's gonna,
yeah.
and then it's like, no, it actually, like it's such a misinformation.
Yeah.
So much marketing and money.
Yeah. It's a real mindset shift, right? So instead of thinking about like, how is it a 180? I think about it as like, we're learning new things every day. That's always why I've loved working in cancer care, is because it's not like if you worked in like cardiology, like heart attacks and strokes, like it's so well researched. Like if there's a big breakthrough, it's like this minor little thing.
Yeah.
But in cancer, there's so much we don't know.
Right.
So when something new comes out, it's like a big deal. It's a new drug. It's like, it's exciting.
Yeah.
So with food and cancer, I'm always thinking there's so much we don't know. So we've just learned new things.
Yeah. Quick question about your own cancer journey.
Yeah.
Just really, really quick. What kind of cancer did you have?
I had ovarian cancer at 30. Yeah.
Okay.
Yeah.
So how long ago was that?
I'm 37, so I'm 7-year survivor. Yes.
Congratulations.
Yeah, thanks.
That's amazing.
Did
Yeah.
you find it from your symptoms?
I did. Yeah.
What were, okay, I know you listed symptoms,
Yeah.
but what were the symptoms?
My symptoms were so vague. Like, honestly, they were very vague. It was right after I got married. We had gone on a honeymoon to Italy and Greece for 2 weeks. And we like ate.
Yeah.
Because why are you going to Italy if you don't? Okay.
Oh.
So it was like pizza and cheese and wine. And like we got into it, right? When I got home, I had gained weight. Like, this is not shocking. Okay. But then I started to try to like get back to my normal habits, and I wasn't losing weight. And then I started to get really bad heartburn. Like heartburn all the time. Like was keeping like Tums in the drawer of my desk. And I just thought, I really didn't like being a bride. Like I love being married, and I've been with my husband for a long time, but I didn't like the wedding aspect, the planning. So I was like, did I just stress myself out?
Yeah.
So I went to the doctor thinking like I have an ulcer or something.
Yep.
And she was like, well, you just got back from your honeymoon, so let's see if you're pregnant. Oh, I'm not pregnant. Okay. And then she's like, okay, let's just send you for an ultrasound of your ovaries. Because she's like, there's lots of weird things that can grow on ovaries, not cancer, like you're young, you know. Sent me for an ultrasound. I had a tumor that was the size of a football. Yeah.
Sorry.
No, it was
You're so
huge.
small. I'm like, oh my
Yeah.
gosh.
And so you would think I'd be like,
Pregnant. Looking
Right?
pregnant.
What?
I kind of
I'm
looked.
sorry. I know I
I'm
like
literally-
gasped this thing,
No,
but I'm
no.
just like, I thought you were going to be like the size of like, I thought she was going to be like an orange.
Yeah.
And I'd be like,
thinking
okay.
this size.
I was
Yeah,
like,
like an
I can
orange.
deal with that. But
Yeah.
football?
It was huge. It was massive, right? So like my stomach, it kind of looked like I had just eaten like Chinese food.
Yeah.
maybe.
Yeah. Like
I was
all
like
that
a little,
MSG.
yeah.
Yeah.
But it wasn't like, whoa, what's wrong with you? You know? And so then I have this massive tumor on your ovary at age 30. That should not be cancer. So those things happen. It's typically a teratoma is what it's
Yeah.
called. So it's like big and ugly and gross, but it's surgery and that's it. You're done. Okay. But then all roads started pointing to this is not a teratoma, this is cancer. So then diagnosed with cancer even before my surgery and had,
Did they do like your blood?
yeah,
Because
and
that's
a
a big
CT
one I
scan.
heard, right?
Yeah.
Because if you're like white blood cell count and all that,
They did
jazz.
quite a few different blood tests, but then also a CT scan
Wow.
to just see like what was inside the tumor and how it was interacting.
Wow.
And then that's when I was actually diagnosed. Yeah. So massive incision, like the longest incision you can have to remove this tumor.
Whoa.
And then my one ovary was like engulfed, so it was gone. I still have my remaining ovary. And then chemo.
Eesh.
Yeah. All my hair gone.
Did you
Recovery afterwards.
Did you do any like egg retrieval, anything like that?
No, I didn't.
So you've had all your kids.
Yeah.
Wow.
Yeah. It's pretty clear my kids are mine. They look, my husband's like dark feature. He's French, he's dark
Yeah.
features. My kids look like me.
They look
it's
just like
pretty
you.
obvious they're mine. But yeah, you can just, I always say you can really put all your eggs in one basket.
Oh, that's
Yeah.
precious.
So yeah,
Wow.
my oncologist was confident I'd maintain my fertility throughout. And I got to be honest, at the time, I didn't really care.
Yeah.
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 I didn't really care.
Yeah.
You're
'Cause I
like,
was like,
That's not where your
save
thought
my
is.
life.
Yeah.
Yeah.
And I get like some women, many women will not have that same sentiment. And I respect that. For me, I was like, my life will be good with kids or without kids. But save me. Like,
Yeah.
Save me. Save
Wow.
me.
Wow.
Yeah.
That's incredible.
Yeah.
Well, this was just like, I really enjoyed this conversation. I think that there is going to be so many women out there who are probably driving and like touching their boobs and like,
Good.
you know, they're like going to buy their soy and get their edamame.
Yeah.
We've learned a lot today. We always like to wrap up our podcast by asking a question,
Yeah.
which is, would you share with us your favorite piece of advice that you've ever been given or that you like to give others?
Oh gosh, you know, I've had to. I saw you guys were going to ask this question. I really had to think about it, because I think I've been given so much advice that I didn't take. You know, it's like it's like an Alanis Morissette song, right?
yeah.
It's like the good advice that you just didn't take,
Yeah.
right? I think the best advice I got that actually landed with me was when someone said, like, you have to bet on yourself. And that is truly what I do. Like, I believe in no one more than I believe in myself.
Yeah.
Because I'm like, if something's gonna get done, I'm the person, like I'm the one. And it's the same with your health, right? Like we talked about advocating for yourself and your care. And like, I would just always bet on you.
Yeah.
I love that. That's so beautiful, especially with your story, you know, and everything that you've been through.
Yeah.
Right. And betting on yourself. We also want our listeners to be able to find you.
Yes, yeah.
So Tell us about where to find you, your socials, any resources, anything that you got going on that people can check you out, how they can work with you, any of that kind of stuff.
Yeah. So I'm most active on Instagram and YouTube. Those are my two largest platforms. Excuse me. Instagram, you can DM me there, message me. I'm control it all. Like you'll get straight to me. YouTube's a little harder to message someone, but there's lots of really good content there on YouTube. Now there's lots of free resources. Probably once a week I do a workshop that's free for anyone to attend, and it's with me. I have so many free downloads. My most popular is probably 15 simple cancer recovery recipes for women. That's my most popular one. But there's lots there. And then you can always work with me too. I take on clients directly, and I have my Cancer Freedom Program. That's like my flagship program where I help women recover fully from cancer, get back to their high functioning selves, and put cancer in the past.
Yay!
Yeah.
That's
So
amazing.
Thank you so
the
much
best.
for coming out here.
Yeah, thanks for having me.
Thank you everyone for joining us on this episode of the Her Podcast. If you want to follow along with us, you can find us on Instagram and TikTok at its.her.podcast. We can't wait to see you there.